A lot for joining us again on TVC Breakfast. The enactment of the National Health Insurance Authority Act in May of 2022 has been lauded, a giant step towards addressing barriers to the achievement of the universal health coverage. But how many persons, especially at the grassroots, have access to this health insurance? With experts and non-governmental organizations now saying that there is a pressing need for interventions within the healthcare system to alleviate the burden of out-of-pocket health expenses. One of such advocates is Victoria Amu. Victoria Amu launched health insurance for the vulnerable in Edo State. She's also an occupational therapist and joins us now to talk some more about her intervention. Thank you very much for joining us on the program this morning. All right, so tell us about this solution that you're proffering, talking about health insurance for the vulnerable in Edo.
It started with me uncovering that there's something called Edo HIS. Edo HIS is trickled down from the National Health Insurance Scheme of the federal government. However, the beauty of Edo HIS is that it allows individuals to be able to buy into the program. You know, families, so families of 4, families of 8, to be able to buy into it. So one of the days, I just sat down and said, why not an individual? Why should an individual not be able to buy into this program and distribute it for their people? And that's what I did. I bought in the insurance at different levels. You know, the National Edo Health Insurance Scheme, it's able to give you the levels that you can buy into, and irrespective of the level you buy into, you are able to access hospitals. You're able to access private hospitals. You're able to access tertiary hospitals, hospitals like NNPC. Hospitals like all of these hospitals within the area, Faith Mediplace. So what I did was I paid for 300 persons, and I distributed it across the 3 senatorial areas. I had done that earlier before today. We had gone to each senatorial. It seems a very little number, but it went a long way. And what I did was have the vulnerable, that is pregnant women. We hear stories every day because the mortality rate, it's increasing. You know, in today's 21st century, women are actually going to the hospital to give birth to children, and they're dying. And that shouldn't be. No mother should die as a result of childbirth. Then you have mothers who have young children, and because you find young children always sick, you know, babies always sick. When the mothers cannot afford the out-of-pocket expenses, they do not have uncles to help bridge this gap. They stay at home and they go to pharmacy. And what was troubling for me was that if you call any person, be it in Edo, be it in Lagos, be it in Abuja, and ask them one simple question. If you have malaria, you are sick, you are dizzy, you're falling you're feeling like fainting, where's the first place to go? Do you go to the hospital or you go to the pharmacy? The uniform response is everybody goes to the pharmacy. Why would you go to the pharmacy? The pharmacy cannot carry diagnostic check. They will not be able to get your blood and run your blood in the laboratory. If you have high blood pressure, the pharmacy will just use his blood pressure kit that is obsolete to measure your blood pressure and tell you everything is fine. Every day I come in, I hear somebody was just walking down the street. This person was very fine yesterday, and the person fell.
Okay.
So what did I do? I bought into this health insurance, paid, and then gathered women, men, and I did health insurance for artisans. Who are the artisans? This health insurance before today is only available to civil servants. You know, if you work in the ministry, if you work this thing, civil servants.
We'll get to that. We'll get to that level. Okay. But quickly, tell us, how are you getting financial support to be able to actualize this particular dream? or this particular project? And what is the rationale in selecting these individuals at the grassroots?
Okay, it's my money. I have a choice either to build a big mansion and hope that my children will carry on my legacy and live in those mansions, 10-bedroom. I had the option to build a 10-bedroom house, live in a big house, you know, have the society acclaim me as a big woman with a big house with several addresses, Lagos, Benin, Abuja, or I chose to invest my money in the lives of individuals because health is wealth. I'm an occupational therapist by profession. So for me, overall health is wealth. The life expectancy rate in Nigeria is not long because people die abruptly. So for me, it's personal money that I would have used to build houses, I used to put into. And what does that tell you? There are so many other people who are richer than me in Nigeria, you know. There are so many others who have multiple addresses and their children are in US, UK, Japan. They will never come to Nigeria to live, and they still have those houses and just put mates in there. But what am I saying? What can we take out of this is that if you have a maid in your house, you have a house help, you have a babysitter that actually looks after your children when you're traveling, you're on business trip, I think you should get health insurance for them because it's better for them to be able to assess health very early so that they will be able to work for you longer. So that's just, if I have a driver, that's what it is for me.
Right.
And I found that
it
was only Edo East that.
Right. The other leg of Emmanuel's question was how beneficiaries are picked. How are they picked?
Okay, because I termed it health insurance for artisans, I looked at the cluster of bricklayers, panel beaters, tailors, and hairdressers. I reached out to the different associations. Drivers have driver unions. Hairdressers have hairdressers union. Traders have traders union, you know. So I reached out to all of the unions and I asked them to sit and bring individuals, 10 per union. And that's what I had. That's what I had to start off with. So it's been amazing. The response has been amazing. The unions have been able to, it allowed those unions to meet as a group, you know, to be able to select those persons that will benefit from it. And then we had this cluster where I had the Nigerian Union of Journalists, you know, in Edo State. I had them also bring their representatives because beside the journalists who work in big media houses who might also have insurance, those ones who are on paper, those ones who are on print media, most of them don't have health insurance. When there's an accident, they have to pay a huge amount out of the pocket. When there is a break in their health, they have to start seeking for one politician to help them out to pay hospital bills. But when you have health insurance, it is compulsory that the hospital that you are affiliated with from the health insurance actually refers you, if they do not have the services that you need, to a doctor that will be able to provide the services.
Right. So, and what's the sustainability
using the unions
plan?
Have been fantastic.
Right. Well, okay, that point is noted. In terms of the sustainability plan, because, you know, the existing federal and the other options for health insurance, for many beneficiaries, quote and unquote, there is a limit, there is a cap to how far they can go before they will not have to now, you know, supplement payment for treatment with their own money. But what is it like, you know, for you in this health insurance option that you are giving to Edo residents?
That's why I'm on media today. I'm calling on every Edo sons and daughters, the affluent ones, the representatives who represent us, to put aside some money. Tell yourself that every year, to celebrate my birthday, I'm going to buy health insurance for 100 people in my community. The 300 that I bought into, that I paid for and I'm distributing, it's supposed to last for a year. It is a year. It is a year health insurance scheme. When you pay for it and when you are captured by EDOHIS, it lasts you for a year. So after 1 year, I'm hoping that my foundation, Victoria Amu Foundation, will be able to continue, because this is 300 that we did now. We're going to go. This is 300 that we are doing now. By next year, we will do 600. We will do 1,000 because we cannot monetize the life of an individual. Every one of us has an assignment.
Are you saying this is just for Edo residents alone? Are there plans that you extend it to other states?
No. It's a pilot program.
Okay.
So it is beginning in Edo. I'm looking for partners. If I have partners from other states who will buy into it. Lagos is a big state. There are a lot of people with health issues. So if the politicians in Lagos State are willing to buy into it, if there are a lot of philanthropists in the Lagos State that are willing to buy into it, fine. Then the Abuja is also
I'm quite sure you're fulfilled with what you're doing at the moment.
All right.
Yes.
All right.
Yes. I'm touching lives and I'm making it better. And that's where we should be. Every one of us should be at certain stage in our life. We should be able to touch lives and not just build big houses.
Absolutely. A fine place to leave our conversation for now. We thank you very much, Victoria Amu, for joining us on the program, TVC Breakfast.
It's a pleasure. Thank you for having me. And thank you for the good work you guys are doing.
Thanks
awesome.
a lot. Thank you very much.